If you've recently become eligible for Medicare, you might be surprised by some of the costs that comes along with the coverage. In some cases, you may qualify for special programs that can help reduce your costs or cover them altogether. So I'm going to go over some general categories of these programs, and then be sure to check out my other videos where I go more in depth into each program. First thing that you want to see if you qualify for when it comes to helping with your costs is Medicaid. So in this situation, you would be classified as what's known as dually eligible. So this is where you would have both Medicaid and Medicare working simultaneously. And in this case, you're going to have Medicare is going to be the primary coverage, and then Medicaid will be secondary to that. Now, if you're not able to qualify for Medicaid, the next program you may want to see if you are able to qualify for is what's known as a Medicare Savings Program. And so this can help reduce the cost of your premiums, deductibles, coinsurance, and copayments, as well as your prescription drug costs. Next, there's a program known as PACE, and this is kind of a community thing. This is going to require certain eligibility for it, and with this is basically an all-inclusive care for elderly. So this is a Medicare and Medicaid program, and it helps people meet the care of the needs of the community instead of going to a nursing home or another kind of facility. So to be eligible for PACE, you must be 55 or older. You must live in the service area of the PACE organization. You must need a nursing home level of care as certified by the state. And you must be able to live safely in the community with the help of PACE. Now, the next program is what's known as LIS, or Low Income Subsidy. And this program is designed specifically to help you offset the cost of your Part D prescription drug plan. And to qualify for LIS, you will have to meet both an assets test and an income amount. So if you do qualify for this program, then you could have help paying your Part D premiums, and it can help you save quite a bit of money throughout the year. And the last thing are programs that are designed for U.S. territories. So these programs will help you pay your Medicare costs if you are located in Puerto Rico, the U.S. Virgin Islands, Guam, the North Mariana Islands, and America Samoa. These programs do vary by the location, so if this is something that does potentially apply to you, you can call the Medicaid office to get more information about how this works. If you don't qualify for any of these programs, you may be able to save some money in different ways, such as using a mail order pharmacy instead of being filled locally. If you do use a mail order pharmacy, usually they'll provide a 90-day fill, and you can usually get some good savings with that method. Another option is to switch from any name brand medications you're currently taking to a generic version instead. If you're not able to switch to the generic, or there's just not a generic version available, then you may look and see if there's other name brands out there that could be lower cost than the one that you're currently taking. And that's another important thing, is to make sure that you have shopped your drug plan to make sure that the medications you do need are covered the best possible in your area. Keep in mind, not all drug plans are the same. Some companies will have a different tiering system that cover different medications at different rates. So there may be the case where your medication is covered better in a different drug plan. So make sure that you've taken the time to do your research and look into all of your options available. Working with a broker is something that can really help in this situation, as they will definitely be able to show you all the options that are available and help you compare that the best way possible. And finally, if you've opted to take Medicare Part C or Medicare Advantage plans, there are some companies that provide what's known as a Part B giveback. So I've seen this range anywhere from about $50 up to about $100 per month. And so here in 2022, the Part B premium is $170.10. So if you're able to get back even $50 per month on your Part B premium, that could definitely help throughout the year, reducing your Part B premium to about $120 per month. And with insurance, there's nothing for free. So if they're giving you a Part B payback, there's probably some kind of compromise in that plan. Maybe the deductible is higher, or the max out-of-pocket is higher. Just be aware of what the plan details are. Make sure that it does suit your needs overall. If you're in fairly good health, it's probably likely that a Part B giveback is a good idea and could help you save some money. If you are managing health issues, just make sure to really check out the benefit schedule in a plan that provides a Part B giveback, as there must be something in that plan that is not as competitive as the ones that do not provide a Part B giveback. So that's a few different ways you may be able to reduce your costs for Medicare throughout the year. If you have any questions about anything discussed in this video, add a comment below, or you can email me directly. My email is in the description along with a link to my calendar. There you can set up a free 30-minute consultation to speak with me one-on-one. And if there's anything that you'd like to see me go over in a future video, be sure to let me know. Check out my other videos where I go more in depth on Medicare topics as well as other insurance products. I appreciate you viewing today. Thanks for watching. If you found the information in this video helpful, you know what to do.